Hi, I'm Dr. Jonathan Craighead. This is a short video to make sure you're ready for your upcoming knee replacement surgery. Hopefully by now you've had your preoperative physical therapy appointment and have your walker. If you do not have your walker or have not had your preoperative physical therapy, please contact our office immediately. Also, your postoperative home physical therapist should have contacted you by now. Please ensure that they have, and if they have not, please let us know. The JCMG Surgery Center will be contacting you the night before your surgery. Typically, you'll be asked to arrive approximately 90 minutes before your scheduled procedure. It is important that you bring your walker with you on the day of the surgery. The surgery itself usually takes about an hour, and typically you're in the recovery room for 1 to 3 hours afterwards. We have sent your postoperative prescriptions to the pharmacy of your choice. Please make sure that you pick them up prior to your surgery. You do not need to bring them with you on the day of surgery. Also, we would ask that you have your home prepared for when you return after the surgery. Please pick up any loose rugs, throws, or cords that you could potentially trip on. If you're on a blood thinner, you need to stop this prior to surgery. If you take Coumadin or Plavix, please stop this at least 5 days prior to your procedure. If you take Eliquis or Xarelto, please stop this at least 3 days prior to your surgery. You should not eat anything 8 hours prior to your surgery. You may drink approved liquids up until 2 hours prior to your arrival. You may drink water, tea, black coffee, apple juice, cranberry juice, Gatorade, Powerade, and grape juice. If you drink tea or coffee, it should be black and should not have any cream in it. Ensure makes a pre-surgical drink that you may take up into 2 hours prior to arrival. It's available at most pharmacies. If you do not want to use Ensure, Gatorade or Powerade work well also. You should not drink any milk or milk products, orange juice, grapefruit juice, tomato juice, alcoholic beverages, or carbonated beverages within 8 hours of your surgery. The morning of your surgery, you may take your normal medications with a sip of water. Please do not take any blood pressure medications, especially if you're taking ACE inhibitors like enalapril, lisinopril, or captopril. The night before surgery and the morning of surgery, we would ask that you shower and scrub your knee with an antibacterial soap. Please do not shave your legs within 48 hours of your surgery, as we do not want you to get any cuts. If you do have any cuts, scratches, or open sores, or any other evidence of infection, please contact us immediately. Once again, it's important to us that you feel safe and comfortable throughout this process. If you have any questions or concerns, please do not hesitate to contact us.